my son's not a kind of a cut and dry case. Our son Will was having some pretty significant behavioral issues. As a family unit, we were all struggling to figure out what to do. We did play therapy, and we consulted with our pediatrician and friends and family, and we were really at a loss. Throwing temper tantrums and being physically aggressive, kind of above and beyond what you'd expect for a 6-year-old, and the non-compliance, challenging everything that mom and dad had asked, that it really weighed on us as a family. Important it was to seek the treatment, because we were really just overwhelmed and at a loss for what to do. I mean, that's a really helpless or hopeless feeling. Someone introduced us to Clear Child Psychology, and that was the start of a really helpful path. It was also a very cost-effective approach. A consultation pretty quick, and I loved her system because she mostly computer-based testing. They were able to deliver what we thought was a really detailed diagnosis. Now, I wouldn't say it was overwhelming though, and one of the cool things, people hear computer-based and they're like, well, I want to talk to a person. And while a lot of the testing was that way, when we got the full comprehensive evaluation, we had a chance to read through it and talk to Marcy and her team as well. I can't say enough about the how great we felt coming out of that evaluation. There was a weight lifted, like, okay, yes, we were right. There was something wrong there that that wasn't at the norm for a 6-year-old, and we've got a plan. We know who to contact, which was also amazing, right? Because I would consider it truly like one-stop shopping. Like, we've seen his relationship with his siblings get a ton better. We've seen his compliance when it comes to our requests get a lot better. Our stress levels are certainly a ton better as parents. Than they are problem solvers, and that they truly care about your kiddos.
Recently been told that our daughter needed a closer look, right? That's what they say. And the thing is, I didn't know. And it's the not knowing as a parent of a child it's the not knowing as a parent of a child with special needs that is the painful part. You want to know what is going on with my child. How do I help them with this? How do I help them to lead the best possible life and be the best version of themselves that they can be? So we had been stuck in this cycle, and just getting out of that cycle was incredible. That moment changed the course of my family's life. The experience that I had with Clear Child Psychology and the CADE program from across the country was more personal than the experience I had with providers down the road. That's the thing that blows my mind the most out of all of this, is feeling like you matter and your experience in the process matters. It was just natural. It wasn't anything that was forced or felt contrived. I felt like my daughter was being able to be seen for who she is. And it is the most personal process that you could have, while also pulling all of the parts that could be negative about having it be personal. So for instance, the bias of a doctor when you're sitting in a room, the anxiety over the reality that like there is something going on with your child, you're worried about the stigma, all of these things that are going on are somehow alleviated by the fact that there is a software program that is impartial, is taking data, and that data is being interpreted and then reflected back to you by people who are very much a person, who have interacted with you and your child, and who have treated you like you're a person. Having a path for her laid out. I mean, there's all kinds of guidance in the report that you receive of places to go locally for you. That would be helpful. Me being a bit of a, I like to look around and see what my options are. I looked at a few other places that were not the number one recommended by Clear Child Psychology. They were on the list, but they said this would be our best option for you. That's where I landed. I can't express the difference that having Clear Child Psychology and the CADE program has made in our family's life. Being able to see my girls with the recommended supports in place and the leaps and bounds they're making, such accelerated progress compared to what was going on with them before. Every parent wants to be able to provide all of the supports that their child needs. And that was one place that I really struggled, was I always thought, surely if I can help them and everything's going to be fine and they're going to catch up, and they just need time. And that was not the case. And I needed someone to share that with me in a way that made me feel valued, respected, and understood. And that's what I got from my experience with Clear Child Psychology.
So there's really a crisis that's being talked about right now in the developmental community of not having enough providers to meet the demand from general pediatricians. They're recognizing kids at risk for autism and referring them, and those kids are sitting on a wait list of 12 to 18 months in some places just to get diagnosed, and there aren't more professionals coming up in training. So there's a shift that's being needed, and people are recognizing that this has to take a different direction, but no one has quite identified that direction. And I think where we're headed is that there has to be more of a collaboration between the general providers and then the specialists, meaning the psychologists, the developmental pediatricians who can really diagnose the more complex cases. So this tool really puts all of the information and all of the expertise in a way in the hands of the pediatricians to train them and help them feel assured in making those diagnoses of the pretty straightforward cases of autism that a general pediatrician should feel comfortable making, but at this point they don't feel comfortable making because they don't feel like they have enough training or support to make that diagnosis. It makes it easier for the pediatricians in the sense of giving them expertise that they can use this instrument almost alongside a psychologist. It's so detailed in going through all of the different symptoms and signs and characteristics of an individual with autism, because we know that spectrum is so broad and these individuals all look somewhat similar but different in their own ways. So it gives the pediatrician the support they need to feel comfortable, and also a lot of explanation and a lot of detail in giving feedback, even to say this is the profile of your child, not just any child with autism. And I think it helps the patients to get that diagnosis and get access to services a lot more quickly, and we know that earlier services lead to better outcomes. So it benefits the entire community in terms of the providers and the patients and their families. Time piece is really, in some ways, at the crux of this, and it's a tricky one because you can take away all of the time element. You need to be thorough in evaluating, and I think that piece still, this CADE still adds that piece where you're still looking at the entire child, all of their development, all of their learning profile, but you're able to do it in a way that they don't have to spend 4 hours in a clinic visit. They don't have to be undergoing hours of testing, and their parents don't have to be sitting at a clinic for hours. So I think it's a really perfect balance between enough time that you're seeing the whole child and not so much time that it's exhausting and overwhelming for the child and the family or the provider who's implementing it. Really felt a connection to Marcy from the first time I met her, and not even really knowing her. My first interaction through email, she just exudes a passion for this area, for helping families. She has been so helpful to me personally. I run a few cases by her, and she just goes above and beyond to really support me, to think things through with me, to connect me with other people or other resources. And I had a really fun day one time. Marcy and Ron actually came up to my clinic just so they could be a second set of eyes in the clinic, and it was so wonderful to work with them. I actually wish I had Marcy to be with me every day because I bounced a few questions to her from the patients. Her knowledge and her expertise is just incredible, but definitely marked by a passion and enthusiasm for this area that is exceptional. Just because of the way that the CADE instrument displays that autistic profile. So it's not just you're meeting all of these criteria, but this is where you're having strengths, this is where you're having challenges, and I think it does make it very individualized. So I think we're seeing this as a country across the world that the incidence of autism is increasing, and there are so many people who have a better understanding and know what to look for now. So these parents are bringing their concerns to the pediatricians, and I think for the pediatrician to understand better what autism looks like in boys and in girls at different ages, at different severities, and then to be able to walk a family through the process of a diagnosis, it makes them such a valuable asset to their community, to their patients, even to their partners in the pediatric world, that they have that knowledge, that they can make that diagnosis. And then the next step is to be able to support these families, to know what good resources look like, to know what they should be receiving and what they should be looking for. It makes such a value to that pediatrician. I think it gives the families hope that just felt like their tool is at the cutting edge of what we need in pediatrics right now.